Hi, it's Dr. Elston. We're back again today to talk about a patient with stage 1 to early stage 2 lipedema that's now a year out from her surgeries. We get a lot of questions about what is it going to look like a year later? Is the lipedema going to come back? You know, people just don't understand what it's going to be like or what it's going to look like. So I think this patient is really interesting and something that I'm really proud of in terms of the work that we do here, because not only does she look great, but she also has really fantastic functional results. So something interesting about this patient is that she's moving around a lot at work. She's constantly up and down. She works with her hands. She's getting up and down off the ground a lot, and she's also lifting heavy things. So it's a pretty physically demanding job, but she also does a lot of fine dexterity movements as well. And she was having a lot of difficulties with that. She was having difficulties roller skating, sleeping at night. I mean, like myriad problems. And a year later, basically all of those problems have resolved. She's finding clothing that fits better. She's able to do her job much more easily. She doesn't have as much pain, and she can just sleep at night better. So she's a really illustrative case about how lipedema reduction surgery can make you feel better about yourself, but also just kind of make you feel better in a day-to-day. So it's really important that we highlight patients like this, because I think it's important that people see what things look like over a longitudinal standpoint. So if you have a surgery, what does it look like a year later? How do you feel a year later? Do the results hold up? What's also interesting about this patient is that she told me that she had gained about 15 pounds over the last 6 months or so, and is now starting to lose it. But when we look at the photos where she was 6 months ago when we took 6-month post-ops, and now a year later, the lipedema hasn't come back. She actually looks better. So without further ado, we're gonna go to a presentation here with some of her photos, and I'll be walking you through that. So we can see here on the left side, this is her before photo, and this is from May of 2023, and then the photo on the right side is after all of her surgeries, and that's from March of this year. So you can see that she has late stage 1 to early stage 2 lipedema with some early pebbling on the thighs, particularly on the left. She has minimal to moderate ankle cuffing on the left side as well. We can see that she's got mild to moderate saddlebags that are sticking out that kind of emphasize the width of her body at that point, giving her more of a pear shape. And then we can also see some of the fullness in the lower back and the trunk. On the right side, we see after the first 4 surgeries that she had, where she's got much improved results. But then when we look on the next slide, this is her at a year out. So again, these are the May 2023, and then these are photos from August of 2024, so a year after her first surgery. So she continues with really skinny legs, skinny ankles. We can see her knees much better. She's got much more definition of the outer leg muscles. We can see here this line between her quadriceps muscle and the tensor fasciae lata. We can see that in terms of just the circumference of her thighs, significantly smaller. She's got way less of a bulge on the outer hips after having the saddlebag reduction. So here's an oblique view. Again, this is May of 2023, and this is 6 months after her surgeries. We can see much smaller circumference of the lower extremities. We can see that she's got knees that are showing off a little bit more. She's got much more tight definition of the thighs, and you can start to see the thigh musculature again on the right side. And then this is a year after surgery. So still has the maintained benefits of the surgery. The lipedema fat is not coming back. If anything, she's gotten less swelling, so you can see more of the muscle definition and more of the knees. And this is a kind of more of a full body example of the upper part of the body. So we can see that her arms had stage 1 lipedema with just some swelling in the forearms as well as the upper arms. She has a small cuff on the wrist that you can see on the left side. And then 6 months after, we can see that she has improvement of the cuffing and the circumference on both the forearm and the upper arm, but she still looks like she has like a little bit of loose skin that's here. And then when we go to a year out, we can see now that the skin looks significantly tighter. She's got much more of a snapback and approval in the skin quality on the upper arms, and the forearms look tiny. I mean, it looks like that she doesn't have any fat there. It looks like a perfectly normal forearm to me. I really don't see much of a cuff there anymore. We can see in the hips and the butt, significantly better contour. She doesn't have that same bottom heavy bulge that comes from having the saddlebag still in place, and it just looks like a much more smooth silhouette that kind of fits the upper torso. You know, the thing with lipedema is that you have a normal upper torso and disproportionate accumulation of fat in the lower half of the body, and I think that the lower photo a year out looks much more like that half of the body belongs to the upper half of the body, whereas the upper photo, you can clearly see the disproportionate fatty accumulation in the lower hips and butt versus the upper torso, which is normal. So In summary, this is a late stage 1 to early stage 2 patient with lipedema. She had 4 awake procedures that were performed in our Joint Commission accredited office-based surgery center with myself. These were all fully covered by her insurance. So she didn't have to, pay me cash up front. She was able to just pay her deductible and her out-of-pocket max, and she was able to get these surgeries approved. They've been life-changing for her. She is able to do the things that she really enjoys doing in terms of roller skating and hiking and even just shopping for clothing. She can pick stuff up off the rack now versus having to go and find something that fits one area of her body but not the others and get it tailored in. She's sleeping better at night, as I mentioned. Her legs aren't quite as achy. Her butt isn't in as much of a position where it flexes her back so she can't get comfortable at night. She doesn't have the tenderness in her hips or her saddlebags, which allow her to sleep on her sides. She's got much more mental clarity. If anything, she feels like she's ADHD because she seems like her brain fog that she had prior to having surgery has now been removed, and she's kind of firing on all cylinders. She's really fun to talk to, but she's also very, very high energy now. Lastly, I think she just feels better about herself. Overall, she just is a fun person to be around, very eclectic and interesting, and she just seems like she's more of herself than when I first met her. I think it's important to know that she followed all of her post-op instructions. She was very compliant with compression garments and followed the post-op instructions very, very uniformly, and I think she's gotten really good results because of that. So to recap, she had her first surgery in September of 2023 where we did 360 legs and knees. We followed that up a month later by doing her arms and forearms. We followed that up a month later in November doing the front of her thighs, and then ultimately we did her lower back, saddlebags, and the back of her thighs as her 4th surgery. So from September of 23 to December of 23, we did all 4 surgeries. They were all covered by insurance. She only had to pay 1 deductible and 1 out-of-pocket maximum. She is back a year later. She's feeling fantastic. She hasn't had recurrence of lipedema, and all of the benefits of her surgery have persisted now a year out. So I think this is a really important surgery. I think we're doing life-changing work here when we help these women with their lipedema symptoms. And I think if you are someone that is considering getting lipedema surgery, I would look more into it. We have plenty of videos on YouTube that you can look at. We have other presentations about lipedema that might show some legs that look similar to yours, because not all lipedema patients are created equally. So they come in different shapes and sizes and different areas that are affected. I think it's also helpful to go out and get information about what the recovery is like and ask other patients. I think lipedema is a very personal disease, and it can feel sometimes very isolating. It's important to understand that there are people that are going through it with you that would be helpful, and they can be found on Facebook groups, they can be found on message boards, even just in the comments of YouTube videos. There are people that will answer questions before I'm able to get to them. So if you have any questions or concerns, we do virtual consults. There are other lipedema surgeons nationwide that are doing really good work and helping out women. But I hope that you all found this valuable. This seems to be a popular format of me kind of explaining how I think about things and how we go through things. So we're going to keep doing videos like this. I encourage you to watch more videos and get more information from us if you're interested in learning more about lipedema. And I appreciate your attention, and thank you for watching.